Hello class, my name is Madonna Green, and for my topic, I focused on the effects of opioids in the post-operative surgical care. So what are opioids? Opioids are semi-synthetic or synthetic narcotics that are often used in the medical field or misused recreationally. Opioids are similar to opiates except for the fact that opiates are derived from opium poppies and can be found naturally. Some examples of opioids include oxycodone, hydrocodone, oxymorphone, fentanyl, heroin, hydromorphone, methadone, and tramadol. However, in this presentation, the focus will be on sufentanil and propofol, a common anesthetic used in the medical field. Many patients experience adverse effects when given these anesthetics after post-operative care, such as post-operative nausea and vomiting, or PONV. I will be talking about this throughout the presentation as this is the focus. Some other symptoms include hyperalgesia, which is the symptom of feeling pain more severely than normal, respiratory depression, or hypoventilation, which is breathing too slowly or shallowly, which leads to too much carbon dioxide in the blood. Another symptom is delirium, which is the lack of awareness and surroundings around you. Immunosuppression, which is the reduction of the activation of the immune system, and of course, physical dependence or addiction. Now, today I chose this article, Opioid-Free Anesthesia to Reduce Postoperative Nausea and Vomiting After Lower Extremity Wound Surgery. This study was done in Eastern China, and this was published this year, 2025. This will be a randomized double-blind crossover trial that we'll be talking about today. The research question for this article is, does the administration of opioid-free anesthesia reduce the incidence of post-operative nausea and vomiting compared to the standard opioid-inclusive anesthesia in post-surgical patients? As I said before, this is a randomized double-blind crossover trial. Both male and adult females underwent 2 different surgeries for lower extremity wounds, no less than 5 days apart. These procedures included the debridement and vacuum sealing of wounds, such as traumatic wounds, wounds after orthopedic surgery, diabetic foot ulcers, venous ulcers, and pressure ulcers. There is also an exclusion criteria to ensure all patients would be undergoing similar treatment. With this criteria, along with participants dropping out, a total of 66 participants were included and completed both trial sessions. Each patient received both opioid-free anesthesia, or OFA, and opioid-inclusive anesthesia, with the randomized 1-to-1 ratio to assign patients to one of these 2 treatment sequences, either taking the opioid-free anesthesia first, then following the opioid-inclusive anesthesia, or vice versa. These were recorded on the AFL postoperative nausea and vomiting risk score in order to collect data. Now, the results of this study come down to 2 outcomes. The primary outcome, which is the incidence of postoperative nausea and vomiting during the first 48 hours of surgery, and the secondary outcome, which is the severity of the postoperative nausea and vomiting during the first 48 hours after surgery. When looking at the primary outcome, the results of this study show that opioid-free anesthesia significantly reduced the incidence of postoperative nausea and vomiting during the first 48 hours after surgery compared with the opioid-inclusive anesthesia. And when looking at the secondary outcome, opioid-free anesthesia significantly reduced postoperative nausea and vomiting severity until 24 hours after surgery and during 24 to 48 hours after surgery. No rescue anemetics were needed after the opioid-free anesthesia, whereas 3 patients required anemetic rescue therapy after the opioid-inclusive anesthesia, which will be shown on the graph I'm about to show you. Now, like I said, in this graph, on the right side, we can see that 3 people that that required the rescue emetic therapy. Rescue emetics is simply what doctors will give you if you are experiencing this post-operative nausea and vomiting. And you can see that 0% of the opioid-free anesthetics were needed in that rescue emetics. We can also see that there was a drastic increase in the post-operative nausea and vomiting for the opioid-inclusive anesthetics, a whopping 22.7%, as the opioid-free anesthetics is only 4.5%. This test has shown that opioid-free anesthetics do reduce post-operative nausea and vomiting in patients in post-operative care by having the same patients receive both anesthetics after 2 different lower extremity surgeries. Now, we do want to take a moment to look at the ethical side as well as the validity of this article. When looking at the ethical side, this study was deemed ethical by the Institutional Review Board of the First Affiliated Hospital of Soochow University. These participants were also to sign an ethical consent form before participating in this study. Now, when regarding the safety of the opioid-free anesthetic, it was actually found that incidences of hypotension, which is low blood pressure, was reduced without an increase of risk of bradycardia, which is low heart rate, which is one of the main risks of the opioid-free anesthetic. Some questions of the validity due to the differing types of surgeries may occur. However, patients in the 2 anesthesia regimes received the same amount of propofol, and the surgery lengths were very similar. And we can ensure this by using the exclusion criteria that we went over earlier. Now, in conclusion, opioid-free anesthetics do reduce post-operative nausea and vomiting. This study opens up many paths for scientists and researchers to follow to determine the optimal type of opioid-free anesthesia, as well as the optimal way of distributing it. This does not only answer some issues, but it also leaves problems to be solved, as science does, which is always a good sign of a valid article. And this is my references for this study. Thank you so much.